While the first symptom of coronavirus is generally a fever, it can take as many as 2 to 14 days for the first symptom to develop in patients. Here is a day-by-day breakdown of how COVID-19 symptoms progress. The Centers for Disease Control and Prevention, CDC, updated its list to include 6 new symptoms to its list of warning signs of the novel coronavirus. Symptoms such as chills, muscle pain, headache, repeated shaking with chills, sore throat, and new loss of taste or smell were included by the CDC. Closer to home, doctors in Ennore hypothesized that the COVID-19 cases within the city may be because of a more aggressive and virulent strain of the novel coronavirus. Previously discovered by researchers in Wuhan, some samples have been sent to Pune's National Institute of Virology, NIV, to confirm the presence of the L-type strain of the virus. The Indian Council of Medical and Research, ICMR, on Monday also issued a revised advisory to the states about the rapid testing kits, urging the states not to procure these kits from certain Chinese manufacturers. Here is a day-by-day breakdown of how the symptoms of COVID-19 progress in patients. Day 1, patients will run a fever and may experience fatigue, muscle pain, and dry cough. Day 5, researchers found that it took an average of 5 days for signs of breathing difficulties to kick in patients. Symptoms might include shallow breathing, tightness in the chest, heart palpitations, and wheezing. Day 7, for most patients, Day 7 would mean the end of phase 1 leading to diminishing symptoms. Doctors at this time advise continuing self-isolation to discard any further complications. Day 8, severe cases tend to develop signs of acute respiratory distress, according to a study from Wuhan. The NHS terms this as life-threatening where the lungs cannot provide oxygen to other organs. Day 10, if patients exhibit worsening symptoms, they are admitted to an intensive care unit, ICU. Day 12, in the Wuhan study, fever ended for most people on day 12. Many still had a cough. Days 13 to 14, for those who survive the virus, breathing difficulties generally end on these days. Day 17, on average, people who recover from the virus are discharged from the hospital after 2.5 weeks. Day 18, for those who do not survive the virus, the average number of days from onset of symptoms until death is 18.5 days.